we present Endomersion, an immersive remote guidance and feedback system for robot-assisted minimally invasive surgery. In surgery, it is already standard practice to consult experts who are unavailable on-site. Currently, this is mainly done through telephone or video conferences. However, this limits the amount of insight the remote expert can gain into the current procedure. Especially for minimally invasive surgery, where the regions of interest are only accessible via cameras and instruments that are inserted through small incisions, this impedes the expert's ability to effectively reference areas of interest. To enhance the current state of the art, we created the Endomersion system. Endomersion connects the operating on-site surgeon with a remote expert that can provide necessary guidance and assistance during the surgery. The system was realized with the Unity 3D engine, the Meta XR SDK, the Robot Operating System (ROS), and a plugin for ROS Unity communication provided by Unity Technologies. The operating on-site surgeon is provided with two separate views of the endoscopic camera output using the displays available in the operating room. The first view shows the unaltered video output from the stereo endoscope camera, which can be perceived stereoscopically using 3D glasses. The video stream is transferred directly through cable to provide the surgeon with an unobstructed, minimal latency perspective. The second view overlays augmentations created by the expert directly on the video feed. Together with ensured verbal communication, this enables the surgeon to most effectively follow the remote advice. The remote expert wears a mixed reality head-mounted display showing the three-dimensional output of the on-site stereo endoscope camera, which is attached to a robotic arm, and a UI for communication and annotation tools. The expert can control the viewport of the endoscopic camera with the provided controllers and has an audio connection with the surgeon. The remote expert can communicate with the on-site surgeon via an integrated audio chat and has an additional nonverbal communication channel enabled through annotation tools. The first of those is a simple laser pointer tool, allowing the remote expert to directly point to specific locations in the endoscopic view through pointing gestures with his right-hand controller. The second one is a pen-like annotation tool, where lasting telestrations can be made in the endoscopic view through drawing on the video feed. Here, the expert has control over the type, color, opacity and width of the drawn lines and can edit these properties afterwards or delete single or multiple lines. The third tool allows the remote expert to place comparative visualizations, like MRT scans, in the endoscopic view and share them with the surgeon. These visualizations can be annotated, rearranged, their opacity edited, they can be temporarily hidden or deleted. The remote expert can also control the viewport of the endoscopic camera by changing the location and orientation of the endoscope itself. This is done by steering the robot arm holding the endoscope with the left-hand controller. To prevent accidental steering, the control mode needs to be activated by pressing the grip trigger of the controller. Then the joystick can be used to control pitch and yaw of the camera, while spatial rotation of the wrist around the forward axis controls the roll of the camera. Zooming is realized by moving the controller towards and away from the body, mimicking the actual physical movement of the endoscope in the body. These interactions lead to the control scheme shown here for the handheld controllers of the MR glasses. Endomersion provides remote experts with a previously lacking live 3D view of the minimally invasive surgery in an immersive workspace that can be expanded in 3 dimensions. It enables the remote expert to take control over the camera view and expands the communication between on-site surgeon and remote expert with deictic telestrations directly at the areas of interest. This way, Endomersion provides both sides with significant additional information in a remote guidance scenario during minimally invasive surgery. For more information, please refer to our manuscript.